Hello dears, welcome to the Soundarya Nursing channel. So in this video we are discussing the very important questions in nursing foundation. So let's get started. First question is essential of good communication. Okay, essential of good communication. Second question, urine test for sugar. Third question, types and purposes of position. So types and purposes of position will they ask, but first you have to be write the definition of position, then write the types, then after that write the purposes of position. Next question, nurse's responsibility in administration of steam inhalation. So what all are the nurse's responsibility is no in the providing the administration of steam inhalation. Just write it all and write the first what is steam inhalation, after that write the nurse's responsibility. Next question, cold application. Define the cold application, purposes of cold application, and write the indication contraindication of the cold application. Although this is the 4 marks question only, but you have to write in a detail in a shortcut way. Next question, factors affecting pulse. Next, oral hygiene. Next question, universal precaution in infection control. What are the universal precaution will be there no in the controlling of infection? Just write that all the point. Next question, active and passive exercise. First write the what is the meaning of active and passive exercise, right? Active means what and passive exercise means what? Okay. Next is routes of drug administration. Here the difference will be there. Okay, don't rush with the question, just read it well and after that write. Active means how the exercise will be going on and passive means what. Okay, active, here the patient will be do his activity, his or her or his activity, her or himself. Passive means as a nurse we have to be demonstrate to them that how to exercise. Okay, so many differences will be there here, so read it well and write. Next is routes of drug administration. Next question, rules and responsibility of nurse. As a nurse, what are the rules and responsibility will be there? So write it all the rules and regulation or responsibilities. Next question, collection of urine sample, urine specimen. For the urine specimen, what type of collection will we do? We will collect. So collect the all means write the all the collection of urine specimen what we need. Okay. Next is methods of physical examination and the rule of nurse in physical examination. For the physical examination, what type of methods will be there? Then what is the rule of nurse in physical examination? Next is records and reports. What is the meaning of records and what is the meaning of reports? Then after that write the difference. Okay. Next question, principles of bed making. For the bed making, some principle will be there. So write that all the principle. Before that, write the definition of bed making and just start for writing the principle of bed making. Next is classification of hospital. In the hospital, there are many classification is there. So write that all the classification. Next is surgical asepsis. Surgical asepsis means what? First write the what is the meaning of asepsis, that is free from microorganisms. Then after that, what is the meaning of surgical asepsis? So write in detail. Next is rights of administration. Means drug administration only. Rights of drug administration or rights of administration means same. So write all the rights. Next question, communication process. For the communication, some process will be there. So write that all the process. Next question, stitch bath. Stitch bath is very important questions. Okay, just focus on this. The meaning of stitch bath, the procedure, and the some here not indication will be may not come maybe, but yeah, stitch bath the procedure will be there. So and the duration, all this thing will be come in this question. So read it well. These all our questions are very important. Okay, just read it well and well. Next is list the principles of bed making. Again the question is repeat. whatever right now I told no question, that all are repeated only, but here this question again I written. Okay, but all questions are repeated and very important. Make sure that you practice. Next is nursing care of patients with bed sore. With a bedridden patient, how we are going to care to that particular patient. So write your responsibility in a bed sore patient. Next, most important long questions in nursing foundation as well as in the first aid also. First is define normal body temperature. B. Write the different methods of checking temperature. C is explain the nursing management of patient with hyperparexia. Okay. First A is define body temperature. Definition of body temperature. Then different method of checking temperature. Next is patient with hyperparexia management, nursing management. Next question, write the meaning of discharge of patient. Definition or meaning of discharge of the patient. Next B question is list the types of discharge. C question, explain in detail the discharge procedure. Write in detail about the procedure of discharge. Okay, this is the second question. Third question, A. List the sign and symptom of dying patient. B. Explain the nursing care of the dying patient. So here they asked directly sign and symptom. So first you write what is the meaning of dying patient, right? After that start to write sign symptom. Next in a B, explain the nursing care of dying patient. Next fourth question, in that A, define oxygen administration. B, explain the procedure of administration of oxygen by mask method. First write the definition. Okay, after that you have to explain the procedure, how you are administering the oxygen by the mask method. Just explain in detail. Next fifth question, first A, define fracture. B, explain the nurse's rule in providing first aid for fracture of femur. Right, first definition of fracture and role of nurse in the fracture of femur bone. Explain in detail about your role. Okay, nurse's role. Next sixth question, in the sixth question, first is A, define bed bath. What is the meaning of bed bath? Next B, what is the purposes of bed bath? Okay. Third C is explain the procedure of bed bath. Okay. Next seventh question, define physical examination. Definition of physical examination. Next B is what is the purposes of physical examination. Next C is explain the different method of physical examination. Next 8th one, first A is what is exercise. Definition of exercise. B, what the purposes of exercise. Purpose of exercise, why you are doing the exercise, right? The purpose is very important for exercise. Okay. C is explain the effective of exercise on different system of the body. Next 9th question, in that first A is what is first aid, meaning of first aid. Second B, list the golden rules of first aid. Next C, explain the first aid management in dog bite. Explain the first aid management in the dog bite. 10th question, first A is define catheterization. B, list the indication of catheterization. C, explain the procedure of catheterization for male patient. For male patient, explain in detail about procedure. Okay, for the male patient, what we will do in the procedure, step by step we have to be explained. Next 11th question, in that A, define nursing process. Definition of nursing process. B, steps of nursing process. C, explain the assessment in detail. Okay, definition of nursing process, steps of nursing process, and explain the assessment only. They asked about assessment only, write in detail. Next 12th question, first A is define admission. B, explain in detail types of admission. Okay, types of admission will be there. So just write in detail about types of admission. Next question, 13th. In that A question is define comfort. B question, explain of any two position used for physical examination. For the physical examination, write in detail about any two position for the physical examination. 14th question, in that A, define drug administration, and B, explain the various route of drug administration. 5th one, in that A, define first aid, and B, list the aims and principle of bandaging. Okay, these all are the short and long questions in nursing foundation and as well as in the first aid JNM first year. So I hope you like this video, and if you have any doubt in these questions, then please let me know in the comment section. Thank you for watching.